First, I want to start with a story that got me thinking about this. I think, like, how many of us here have aging parents, like, that you kind of like are any day now, you might get that call and you think, okay, whew. For me, it wasn't a parent. It's actually my grandmother who was she's like, to all of us 7 granddaughters, my poor granddad, he never had a grandson, all granddaughters. She was like, that standard grandmother that invites you in, here, have a candy. It's like orange slices, the fake ones, the sugary ones. And then you sit down and she's like, tell me all about your life, as if it was an offering to you to have that little bit of candy and then sit down next to her on the recliner. Have a big, long conversation. She gives you the kiss and the hug, and you feel like, everything's going to be okay. That just kind of gives you the sense of who she was. That's her right there. I had a bad pregnancy and we did a racing of our scooters through the mall. Anyway, that's a whole separate conversation, but because I was having so many problems and was down about that. But anyway, so that's her way to cheer me up. But the thing about this is that, we had these moments, and I'm going to have to flip ahead, where this was like taken, just a few months before she actually had this major melting event, as my grandfather called it, where she just kind of lost blood pressure and melted into the floor. And that became, that moment kind of defined the way we were thinking about everything in my family, because we all revolved around my grandmother. She was truly the matriarch in every sense of the word. And so when my grandfather called my mom, she was living 2 states away, about 5 hours away, and he was like, I don't know what to do. I'm just freaked out. They've been married for 67 years, and the thought of losing his high school sweetheart was just, too much. And so my mom called 911, and then she called me, and, we raced to get to that hospital she was care flighted in. But there was lots and lots of things that had led up to this moment. And my mom did make it in time to the hospital, by the way, to see her and make her feel better, actually. And that human touch and that just having my mom there actually brought about a whole different thing. We really thought she was on, death's door, and then all of a sudden, she's there. And then she snaps right back. I mean, it was just amazing what the human touch and just that presence of my mom did for her. But because there was so many, that was just the start of kind of like the spiral of things that had to do with, I'm doing one but not the other, of poorly administered medications, missed appointments, trips and falls. You can see all the list of things that had been occurring. And by the way, they live in the country where you don't get easy access to emergency medical professionals or anything like that. So this had me thinking, it all fell on my grandfather, who was kind of overwhelmed. In addition to, that he's facing down, death and, and he's just like the strongest guy you could ever imagine, still baling like 70-pound bales of hay at the age of, 80 something. But this took him down. I mean, trying to figure out all these different specialists and all their different instructions, all the different portals, 5 different medicines. They're all interacting in different ways. And those are the most interactive drugs you can have on the planet. You take one, and then you have to have a diuretic to get because she had cardiac or the congestive heart failure situation where everything's collecting fluid constantly. So, I mean, this is overwhelming. And as you get older, that's just going to keep escalating. And that's exactly the time when you don't want to have to be tracking a lot of stuff. And for those of us who want to take care of our parents, that's exactly when you don't want to have to be tracking down all this stuff either. So I started thinking from an AI standpoint about all the different types of projects that I had been engaged in, the hospital at home idea. How many of you have heard of the hospital at home? trying to bring the hospital to the home. Digital human, have you guys heard about digital human? Okay, yeah. And I was thinking, and then of course all the standard stuff like nutrition apps and, what happens when we have too much caffeine or not enough water or too much sodium or whatever, and then even the genetics of the whole entire thing, because my great granddad actually passed away with congestive heart failure as well, so it had me and my mom thinking a lot about a lot of things. And so when you get to that and you start thinking about convergences, I started thinking about where can this all come together. Can you guys think of anything that has been a major technological convergence that's happened in our lifetime that has really changed the way we do everything? Yeah, the smartphone. I mean, you have your Alexa skills on there. The Alexa skills are like the most simplest thing on the planet, but yet they are interoperable with so many things. And even my grandmother, like you said, can talk to Alexa. So it's like interoperable with old people too, right? Because sometimes it's not just about interoperability of systems, right? Sometimes we have to be, it's interoperable with old, yeah, tell Amazon I said that, they can pay me for that. It's interoperable with old people, and that's important. And so I started thinking, what if doctors could prescribe treatment algorithms that could actually, and we're talking about the future, right? But think about this with me. Think about how many things we have in our homes now that are, even the health insurance company sent my in-laws recently a package that included wearables. It included a blood pressure cuff. Think about all the things that got sent during the pandemic to help people take care of themselves in the home. And I was thinking, all right, if we could truly deliver on this hospital in the home idea, how much would we not, and then selfishly also I'm thinking, like, how much would we not be tethered anymore, right? Because the first thing that happened when that scare happened with my mom, she immediately dropped everything, dropped the job, and like moved to be right across the street from her. I don't know, not many people can afford to do that in their lives, and not many people want to do that, quite frankly. But if we could take care of our family members from a different location, how much better would we be? And a doctor could actually prescribe a lot of the things that we need, like preventative care, the monitoring part, and then what happens, like set emergency protocols in our house even. So if we think about all the connected home stuff that we even have, locks, and right now that should scare you because all of us are like cynical and we think, oh my God, I would never trust. Like when Amazon came out with that service where you could actually have things delivered to your garage, how many of you were like, hell no, I'm not doing that. I don't trust some random stranger to drop junk off in my house. But that's what I'm saying. The trust is going to be essential in the future if we really want to take advantage of all the cool things out there. Sorry, I keep doing this where I have the one but not the other. So I kind of outlined some things that I thought could come together in the preventative care. I tend to think of it as three things when you're talking about taking care of yourself. And I'm thinking of it not from like a drug standpoint. I'm not thinking of it from, a clinician. I'm thinking of it from a patient standpoint. So what do I need in my care algorithm, in my heart health algorithm? And to me, it's things like setting up treatment defaults and connected devices. So maybe in the future, your fridge won't order that bacon and hot dog that you want. It'll just, so when it refills its Amazon grocery, like right now you can talk to Alexa and have your things refilled. It may say, nope, you're on the heart health algorithm. Hot dogs are not recommended anymore or whatever. And you may override it, but at least it will give you an alert to say, hey, this is a high fat, high sodium thing. You may not want to get that. And that could be irritating, but we're talking about older people, so maybe that will work. And then, what if it could also just automatically set up all your calendar events for you with the doctor? Just be interoperable with their calendaring. Like Calendly, we practically have that today. How hard is this going to be to just go ahead and have those automated? We could automate our health future. And then pre-emergency types of things where you can detect, when someone's heart is starting to escalate, their heart rate's starting to escalate, and it may be time to have an intervention of some kind from some sensor sensors in the house using some robotics or something like that. And then definitely emergency protocols. And that little bot over there, there's been lots of talk about how we could, have AED bots. And yeah, we talked about drones, Elias and I talked about drones in the house, but definitely, I mean, those are ready to go today. They could just roll out from your couch, roll out from your bed. They could be placed in every single room and come find you. So there's no reason as elderly are, dying alone these days. And 95% of people who have a cardiac arrest, if they have it alone in their home, they're going to die. I mean, this is something they don't come back from. I mean, I hate to be so heavy on a Friday. You're welcome. So anyway, so I want to take you through, if you can just bear with me, I'm going to take you through a little bit of what I have in my book about this situation. And if you want, of course, I'm going to recommend to get the book, but I don't actually get any money from the book. So my publisher will, thank you. But I actually set this whole entire thing up in that so you can see the whole scenario and how likely, maybe you want to look at it and outline parts of it that maybe we can't do, you want to laugh about, or other parts that you think, maybe we could do that actually. But I'm going to give you the scenario. So my mom's holographic affidar appears with two areas in red. And in my mind, I'm envisioning it would have like a heart and a lung situation here. She's sitting there and she's having a hard time breathing. She can't talk. Her AI assistant has activated an emergency care protocol designed to tell and show me what is happening with my mom, especially since she can't do it herself. And she's grabbing her chest. Mom's AI informs me that she's having a heart attack and it came on suddenly. Her AI has contacted 911. Help is on the way. My mom's AI had been trained by the bedside cardiologist group. Mom and I picked their health AI because they were known for building a good bedside manner into their heart health assistants with added empathy training and a specialty focus on women's health, which I think will be the future. I think people will have built into their algorithm certain values that they make an action and intervention happen that is specific to your value system. That's why I said that earlier today, if you heard me. Then the worst happens. Let's see. According to BCG, so the empathy training included contacting family and loved ones in an emergency. According to BCG, patients' mindsets were key for survival in these life or death situations. I'm grateful for this ability to be there for my mom, even though she lives 2 states away. I tell her I'm there and hang in there. I watch as a little drone, about the palm size. This is real, by the way. It's actually a real thing. It works. A little palm-sized drone brings her nitroglycerin pills and water. She takes them and her AI assistant unlocks the smart home's doors so the emergency response team can get to her more quickly. Then the worst happens. She passes out. Q, my assistant, my AI assistant, so you see there's also interoperability between assistants, informs me, and we've talked at length about how to do this, like in my space, in the AI space specifically, how to have interoperability between two AIs. I don't know if you've thought about that, but it gets really interesting real fast. Like, especially we turned them loose to negotiate with each other once, and that was fascinating. Anyway, okay, so my AI assistant informs me that my blood pressure is rising dramatically and I may faint if I don't calm down. So I watch as a defibrillator robot rolls out from under the couch, finds mom, and immediately attaches to send her a bolt of energy. She revives and I let out a sigh of relief. 95% of cardiac arrests occurring alone and outside of a hospital result in death, and she just cheated it. Mom had been fitted with her defibrillator robot using light grid technology, similar to how a 3D printer scans dimensions. Have you guys ever used a 3D printer? Have you seen the scanning and how that function works? I think we can do a lot to help fit people in their homes by doing stuff like that. Her measurements were taken while she laid in various positions on the floor. She kidded me at the time, what if I get too fat for my AED robot? Because the measurements wouldn't come out. Anyway, Q has full access to the vitals on mom's smartwatch during an emergency protocol, as agreed to by mom and me in advance, so there's the trust aspects. To calm me, Q informs me my mom's heart rate is back to normal and reminds me to breathe. Has learned from she's learning my interactions, right, from other emergencies, that I calm down faster when I'm focused on doing something. I escalate the more helpless I feel, which is actually true. I think we all do. To distract me and focus my attention on doing something helpful, Q asks permission to book me on the soonest flight. I say, yes, Q. This time, no budget constraints, because I'm cheap like that. And then just get me there. Q says, on it, now breathe. If we can get your heart rate lowered by 5 beats per minute, you won't faint. Q's right. I feel nauseated and lightheaded. I watch the paramedics take mom away on a stretcher. I ask which hospital they're taking her to so Q can order flowers. Set up a car service to pick me up at the airport when I arrive. And then I take a moment to breathe and start to feel less panicky and nauseated. Q lets me know, this is the last part of the trust elements. Q lets me know, just like last time, it will supervise my mom's AI assistant. Mom and I agreed in advance that if anything ever happened to her, my AI assistant would supervise hers to ensure that that anything that requires her permission will instead come to me. As a result, Q lets me know that my mom's AI had given her permission to submit her heart attack warning symptoms back to the bedside cardiologist group to help them train their AI. I give my permission as well. It's what mom would want, and I'm feeling especially loyal to that group, given that they never take our privacy for granted. And oh yeah, they saved her life twice now. The warning symptoms are logged by her AI assistant and sent to her doctor as well, digitally, along with her unified care record and personalized medical routines and everything that happened in the house. What do you guys think? That's a lot, right? I think that there will be more of this bedside cardiology group type idea. I mean, I don't think that I know of, that's not a real thing, but not today. What do you think of that, though? And what do you think about converging everything into these personal assistant type, ideas? I was reaching for my cell phone, which I don't know where it is. Oh my God, panic. My whole life's on here, literally, as we talk about it.
The realm of possibility. I think a lot of these disparate technologies exist. I think the issue is that how do we bring them together? Not loud enough? Oh, I'm sorry, April. Okay.
It's official, so don't say anything you don't want to regret.
Okay. Noted.
Pressure. So not talking now.
Veil of silence. But I agree with you. I think there's a lot of technologies out there, is that they're not integrated. One of the issues that we see, I think the vision that you kind of paint is sort of integrated. You have multiple technologies working together, integrated in a way that actually is reflective of the values of the patient and their family. Yeah. So a lot of work still has to be done there. But I mean, the drone technology, the other colleague that was mentioning, as far as military technology, there's plenty of technologies out there. The integration, the interoperability, I think there's always, and the privacy is one of the biggest barriers and challenges that we need to address. I don't know, what do you guys think?
I think one of an important factor to look at is compliance of the patients to use all these technologies. From our experience in clinical trials using wearable devices, there's a relation, the declining relation between compliance and the number of wearables or devices you have the patient to interact with. So that's why a lot of technology now is actually being put into have it all in one wearable, so that it's more comfortable for the patient, and there's a high compliance for that. So we should think, I think importantly, we should think about that.
We could have embedded sensors when you detect dogs.
Yeah.
Yeah.
And that's the other point also. The more it is actually touching the body, the skin, the less the compliance is. So patients don't like to have, for example, between an ECG patch on your chest and a watch, they would prefer to have the watch to monitor their ECG.
Because it's removable.
Yes, exactly. Yeah.
And I'll just mention, so the one thing that I'm really big on, because I do think that these are the kinds of scenarios that we want to have in the future, but I think I wouldn't take any of that stuff right now, because I wouldn't trust that might have any level of privacy whatsoever. I don't know that I would trust the data scientists who have currently, that I have observed in my profession, and how they're fast and loose and they don't document anything, and they haven't even, there was one group, honestly, you guys, the stuff I've witnessed, there was one group that was like, let's have a chatbot that will tell people about their cancer diagnostic. Does anybody here think that's a good idea? I'm just curious. I mean, I just don't, it's like, let's go back to humane. Is this a humane use of AI? Is that even, sometimes people just get these ideas from executives and the executives hand them $5 million and they say, here, now I want you to build me a chatbot to go do this diagnostic. And then we, at IBM, we used to get these calls and they're like, yeah, I got to set up a diagnostic for cancer. It's going to deliver people their, whether they have it or not via chatbot. I'm like, who decided that was a good idea? And so you have to start at the design thinking phase, like before you even start the solution. Is this even a good solution? And do I have time and space like built into this process to push back? How do I push back on executive sponsors who are handing me money? Is there a way for me to do that? So, I mean,
now you have human-centered design, so that is a big concept. I'm not sure if you guys are familiar with it, but sort of, thinking about exactly those elements.
And value-specific design is another area. Value-sensitive design is actually another field as well, where you can start to build in the empathy training. They actually have you talk about your own values, because some of us don't even know what our own values are before we walk into a situation, and then we're like, something doesn't feel right, but I'm not really sure what I might having a problem with here. So sometimes you have to get in touch with yourself about this stuff. The other thing is the consensual part, which is, do we even have permission to use some of the data interoperably with other use cases, which I know you guys are already struggling with that. The other part is trying to make sure that people are knowing when they're actually being used in a data, assessment of some sort or a score. Because most of the projects that I participated in, half the time it's going to go into an application of some sort. And then the other half the time it's going to go into an API feed that's going to give scores to somebody else who's going to put it in their application. So just like did any of you guys see the recent Equifax news where that CEO, so they affected like 130 million people's scores in a bad way, and then the CEO was just like, well, it was some kind of coding issue. But guess what? Equifax gets used underneath every major financial banking model to select or deselect people from different loans, and it also determines what kind of terms you get for your loans and how much interest you have to pay. And it was those types of things, when you are the base that's feeding data out from your models. So as you think of monetizing your models, maybe you're not monetizing your models, I don't know. Are you? Does anybody here monetize your models? Like, do you know if your scores are being sold? Do you know? Or okay. Well, anyway, you got to think about that kind of stuff, and then providing people transparency with it. And then the accessibility. Am I giving people a chance to weigh in on the actual, is it agency imbuing in any way for me to produce a score on somebody and then not tell them? And this is, I guess, more specific to patients. And then explainability, we've talked a ton about that, privacy and security, using fair and quality data because we don't want to overfit or do something that might cause a wrong decision. Accountability, this is the part that people don't get. So number 12, when I ask any company if they have this, they don't. And that's governance and rectification. Can you fix something if it goes really, really wrong? And who on your team, is there anybody there who's going to actually fix it? And you could say, oh yeah, it's me or it's so-and-so, but then those people leave. So the average tenure of a data scientist is about 12 to 18 months. So most of the time, like when I go places, there's like all this technical debt sitting around, like, and you're like, well, who developed this algorithm? Why are you, what is that going into? Oh, I don't know. So-and-so developed that. That was like a $2 million project. And I'm like, I didn't ask you how much it was, but thanks. But who developed it? And they're like, I don't know. They went on to Google or something. But you see the problem, then nobody's accountable either for when something goes wrong to it. Everybody just goes, well, I don't know. I guess we're just going to have to discontinue it. And that's rarely are people going to let you discontinue it after investing $2 million. And a real life example of the rectification part is like with Tesla, Have you guys seen that video of the two people sleeping in the car in the fully automated Tesla? And the police can't even stop it. Nobody knows how to stop this car. This is something that should have been thought of before, people. Like, why do we have a car that can't be stopped? Because there are no people. Think about when you get pulled over, what's happening? You see the lights and you're like, oh crap, I'm like in trouble now. But no, a self-driving car doesn't see lights and go, ooh, let me pull over. It doesn't. So the same thing can happen in healthcare, though. Think about robotic surgery. Think about, AI-assisted robotic surgery. If you don't put proper constraints, you don't want to blow a hole in someone's chest because it thought it saw this much, but you forgot to remind it that it can't blow a hole that big in a person and a person still live because that's a constraint that needs to be, but we don't think of all those things because we're just doing this in little bubbles. And so you have to think about governed and rectifiable. All right, I see that we're like so glazed over at this point, so I'm just going to finish there. Does anybody have any thoughts left after this wonderful conference that Rework has put on? You guys have done a great job. I was sitting here on a Friday till 3:12. Thank you so much. Okay.